So now that we've looked at the impact of HIV/AIDS on assets, I want to change the conversation and shift it to looking at the impact of HIV/AIDS on institutions. When we think about national governmental levels, it's important to note that as an HIV infection spreads throughout a population, there is a capacity within a government and a social institution to provide social safety nets to support those affected, those people and populations that are affected. And as the affected population grows, the ability of those safety nets to capture and provide for those individuals decreases, because the population of infected individuals can fairly quickly exceed the capacity of those programs to provide. When we think about the national level, it's also important to note that as a population is impacted by HIV, there's an opportunity cost that's lost. So people aren't able to work as long or as productively during their working lifetime. And as these productive age people become ill, the government's able to collect less taxes from them, so there's a diminishing revenue, but then there also is an added burden of the cost to care for those people that are ill. There's also a deterioration of human resources necessary to implement and manage the provision of these social safety nets and services, meaning that oftentimes individuals that are trained in the implementation programs will become sick themselves, and so then there's less workers on the front end to handle the people on the back end. In addition to these social services, oftentimes they're very critical to the livelihood of the households that are affected by the disease, but it's important to kind of think of them in terms of supply and demand. As the demand for this social service or institution increases, there tends to also be a decrease in financial resources available to pay for those services. So it's less money per patient that's available, or less money per community that's available, even though there might be a growing demand within the community to provide that service. So it's essentially having a pie of money, and instead of giving everybody a quarter of the pie, everybody might now get a 16th or a 64th. There's also, when you think in terms of education, as working parents are becoming ill or dying due to the disease, or as instrumental family members are dying or affected, children are having to drop out of school and are unable to attend school. It might be because they're having to go work, or it might be because of the stigma of the disease. Their family might be ostracized at that point. And then there's also, because HIV/AIDS tends to affect those in their working prime from age about 24 to about 35, there's less teachers available to teach in the school system. And so there's this interesting balance that occurs as the epidemic spreads, where you have social safety nets and social institutions that are key to combating the disease, but those are also the ones that are most affected by the spread of the disease. When we look at agricultural services, generally those are also tend to be diminished, because the number of extension workers declines, or the workers that would typically work a field become ill. You also have the market and transportation systems that how many people are available to take a product from the farm to the market. As Professor Coots mentioned in his lectures, a lot of times in transport, that's where people become vulnerable, either to rape or to conflict, but also, as noted in several of the videos that you've watched in this unit, it's also where a lot of disease is spread. Typically, as products are migrating, people are also migrating, and then engaging in activities at various touch points that they traditionally would not have been exposed to. We also, when we look at HIV, we have to examine the impacts on health services. As an increased population becomes affected by this disease, there's increased burden on healthcare institutions that result from the shift of caring for more traditional diseases to caring for the diseases that are most heavily associated with HIV. I want to briefly mention we've provided some resources on the website, some additional knowledge about HIV and AIDS and how the disease actually works, because HIV affects certain cells in your body, and it doesn't actually kill you, but what does kill you are the secondary effects of the disease. So for example, if your cell counts get too low for the cells affected by HIV, then you become more susceptible to diseases that typically your immune system could handle on its own. So I just want to point out briefly that those resources are available on our website if you want to learn more about the disease. But it gets into a little bit more detail than we feel like you need for the purposes of this course, but that those are resources available to you if you want to read more. There's also the World Health Organization and the Centers for Disease Control have quite a bit of information on their websites that's also available to you. But back to thinking of infrastructure and health services, when this disease infects a population, it's important to note that as the population is dealing with the effects of this disease, government only has a certain amount of resources that it can allocate to provide services, and the increased demand of finances that are needed to accommodate health services to provide either antiretrovirals or treatment for malnutrition as the problem is promulgated by the onset of HIV/AIDS. But that money that is then being shifted to help the disease is being shifted away from things that provide services like running water, sewage services, child vaccination programs, school feeding, etc. Because there's only so many ways the money can be divided, and there's not an unlimited quantity of funds. This also has pretty profound effects on the larger overall health of a population, because if you remove money for example, for sewage services, then the larger population health suffers because of that lack of service. So it's very important to note that as HIV spreads throughout a population or a nation state, the effects of the disease are much larger than just the effects on the one individual or the group of individuals that are affected. It's one of those diseases that has a ripple effect in its impacts on society.